So I've been getting a lot of notes from people about cholesterol. Right? There's a number of people out there who are living healthy lives. They're out there exercising. They're out there eating right, and their blood looks good. Right? Their blood sugar looks good. They don't have a whole lot of inflammation going on. Their inflammatory markers are low, but their total cholesterol is high, and so their doctor wants to put them on a statin. Now, my red flag goes up when this happens because just as recently as this year, back in April 2017, there was a study published that suggested that half of all people, over half of all people who have heart attacks have normal cholesterol. On top of that, we also know that lowering cholesterol with something like a statin, and now a statin is a pharmaceutical that lowers your cholesterol for you, right? And doctors have been recommending them quite a bit. There's studies out there to suggest that lowering your total cholesterol could definitely lead to neurological disorders and cognitive impairment. Now, all of this is a mixed bag of evidence, right? And so we know that there's been people with very high cholesterol who've had heart attacks, and there's been people with normal cholesterol who've had heart attacks. We also know that there's people out there who are affected heavily by statins. Their quality of life gets affected, and we know that there's some people out there for whom statins haven't affected much, right? But I wanted to go to somebody in the know to talk about this because I'm not a doctor, I'm not a scientist or anything like that. So I went to my friend, Dr. Mark Gordon. Dr. Gordon is a very well-known interventional endocrinologist. He's been on the Joe Rogan Experience, I think around 3 times. He has many, many very well-known people as his patients, and he's the director of the Millennium Health Center and the Warrior Angels Foundation, the medical director for the Warrior Angels Foundation. And what Dr. Gordon does with the Warrior Angels Foundation is he provides veterans who've been affected by traumatic brain injury and post-traumatic stress with nutraceuticals and hormone replenishment that helps them to return to having normal, happy, productive lives without keeping them on pharmaceuticals for the long term. And so, knowing and respecting Dr. Mark Gordon, I went to him and asked him the question about whether cholesterol was the best indicator for whether or not somebody was going to have a heart attack, and the wisdom of using an artificial source to lower cholesterol. So with that, let's get into this discussion with Dr. Mark Gordon. What's going on, guys? I'm here with my good friend, Dr. Mark Gordon. Dr. Gordon, we were just talking about cholesterol, right? And whether or not cholesterol causes heart disease.
I get the question about cholesterol quite a bit. And if we look historically back in 1986 when the first statin drug came out, cholesterol levels were acceptable at 379. And then over the course of years, it went from 379 to 279 to 249 to 229, and now it's at less than 200. But the changes that happened since 1986 is that the sales of statin drugs went from 0 to $36 billion a year. So we should be getting some improvement in cardiovascular disease. In addition to use of the medication, we also have change in lifestyle where we're more physically active, we're eating better, we're dropping our fats and improving upon our sugars. So one would expect that the level or the number of heart attacks or cardiovascular events that happen should be going down. But the actual fact is that the levels are going up. So the question is cholesterol really part of the issue? Is really the cause for atherosclerotic heart disease, which is hardening of the arteries that leads to narrowing of the arteries and then our heart attack, is that really due to cholesterol? Well, we're finding that cholesterol has a very minor role to play in terms of causing heart disease. And what we're finding are inflammatory chemicals are at the root cause. Something called small density LDL, another called plaque 2, another called lipoprotein little a, A1 and B, and chemical called homocysteine. These are the chemicals that create inflammation of the lining of the arteries that leads to the narrowing of the canal of the artery, and when it closes off, that's when you get a heart attack.
So what you're saying is this isn't fat building up and holding on to the insides of
No.
the walls. This is literally the artery is hardening and then thickening.
Correct. When there's inflammation of the lining of the arteries, our body tries to fix it. The first thing that it sends in to fix it is cholesterol. Why cholesterol? Cholesterol is part of the membrane of every cell. It has cholesterol and fats in it, and it's trying to repair it. But if it fails the ability to repair it and you still have inflammation, the chemistry that we talked about, still present, then it sends in the second attack, which is calcium. Calcium to wall off the area of the artery which is inflamed. And we know with cases that cholesterol has nothing to do with it. I mean, this case right here of a very close friend of mine who had cholesterol between 140 and 150, we do an ultra-fast CT scan on him, and we find that there are signs of these calcifications. And then we did this study, which is an angiogram, and in the angiogram we find that he has 90% blockage, 95% blockage, and 100% blockage of the main artery called the left anterior descending artery. This is called the widowmaker.
Yeah.
He had no symptoms. His cholesterol was 140. So please tell me how cholesterol created this situation. Subsequently, we did a blood test and we looked at these inflammatory components. His levels were very high. So his cholesterol was low and the inflammatory producing chemicals were very high, and that's the reason why he had a score on his heart scan of greater than 2,000.
Now, one more question as far as brain health goes. When you do not have cholesterol, when you don't have cholesterol in your body and you're doing everything you can to lower it, what happens to the brain?
A great question. Cholesterol is the precursor to all the important hormones in our brain. From cholesterol comes the primary hormone called pregnenolone, which is also referred to as the mother of all hormones because it becomes testosterone, estrogen, DHEAS, it becomes progesterone, also cortisol. So if you turn off the ability of our body to supply the substrate or that product that everything is made from, you become deficient. And the deficiencies of pregnenolone or progesterone has been found in Alzheimer's disease, in dementia, in depression, in all the psychiatric problems, anxiety that we see, all from not having the chemistry that is produced from the root product called cholesterol.
Outstanding. Well, Dr. Gordon, thank you so much. Found it.
All right. Always
Guys,
a pleasure.
This guy knows so much. He is a wealth of information. We're going to get more of him if he'll decide to come back on, but I want to thank you so much for coming on.
Just ask me. If it means helping people out there who need the facts, I'm there.
Awesome.